We like to say in the birth trauma community that birth trauma is subjective. And what that means is that it's in the eye of the beholder. And what that means is that it's not a choice that the person is making. So they don't just sit there and say, okay, like I'm traumatized by this experience, but instead it's a choice that the nervous system made in that moment, right? To try to support the person in just surviving.
Welcome to the Mindset Mirror Connection podcast, the podcast where we debunk the eat less, move more, shrink more mentality and focus on what really matters, which includes your relationship with your body, food, self-worth, and the behaviors that align with all of those. I'm your host, Christina Hathaway, licensed therapist with specialized training in food and body obsession, certified personal trainer and nutrition coach. At the Mindset Mirror Connection podcast, we believe what you say in your mind, you see in the mirror. So let's have a conversation about that. Before we get into today's amazing episode, I want to make sure you've hit that follow button wherever you're listening to the Mindset Mirror Connection podcast. Also, if you like to listen to this pod on the go, make sure you have those downloads turned on. As always, I love a 5-star rating and review, and I want to thank you for your continued support. Now, let's get into the episode. What's up, guys? Welcome back to the Mindset Mirror Connection podcast. Today's episode is one that actually blew me away. It left me speechless in many ways and emotional in many ways. And today's guest is Dr. Teela Tomassetti. Dr. Teela is a perinatal therapist and a researcher specializing in birth trauma. Dr. Teela shares her own story of suffering through excessive hemorrhaging, but more importantly, a really traumatic birth experience because of the individuals in the room. And it almost took her life in 2021. And at that time, she decided, you know what? I need to share my story, and started her account, The T on Birth Trauma, a place where she breaks the norms and supports thousands of survivors in finding their voice. Also, she is in her doctoral research, and it's on the activation of the fawn trauma response during birth trauma and its connection to provider mistreatment. Dr. Teela opened the Reproductive and Perinatal Trauma Center, an innovative practice that amplifies silenced experiences, really one of a kind. She's an international speaker and a trauma-informed care consultant where she brings hope to the world together with preventative care and discussions. We talk about everything from her own experience to the experience of those who may not even realize they've gone through birth trauma, including that of partners, and what the medical field can do to better support our mothers. Everyone, welcome Dr. Teela Tomassetti. Yay, I'm so happy you're here. I always say I need a sound effect there, like a woo.
I can do it for you if you want.
Yes, we'll work together. Yeah, we need like a soundtrack. No, for the audience to understand, I was talking to Teela beforehand of how and why I wanted to connect with her. So I had saw a post that you had posted that one of my followers had reposted, and it was on a mother who had just had a cesarean section, and the medical providers had put that baby, who is crying, of course, on the mother, even though the mother was under sedation, to help with that, just regulating that baby's nervous system. At least that's what I, as a therapist myself, had perceived it to be, to bring it to its mother, have that skin-to-skin contact. And even though mom was not coherent, that baby just melted. Mm-hmm. And it made me feel something. And as two very separate things happened, where I was asking my mom what time I was born, and she told me, she said, I don't know, I was out. And I was like, oh, that's interesting. I went through that, but probably not receiving that skin-to-skin contact. And I'm wondering why I had such a strong reaction to that video. So I said, hey, let's ask the source. So here you are.
Well, technically I'm not the source because that's not me in the video, but I will say that it's at like 120,000 likes and counting. And it's gone quite viral. And one of the most powerful things I find about that particular reel is the comment section, because usually when my reels go viral like that, it's like you really see opposing opinions and all kinds of individuals come out of the woodworks. And on that one, you don't. It's like overall, it's like this beautiful outpouring of love for that mom and like a very emotional response to the video. And then, of course, there is one comment that maybe didn't need to be said, and people really go for it on the comment section there of just really trying to correct that person and give space to people who have been through cesarean. So honestly, it's one of my most powerful reels. I'm not surprised that it really struck you and it struck the person that you also follow that kind of ended up connecting you to me.
Yeah, no, it was really beautiful, and to think about the respect that I feel that medical staff has for their patients. It, as a woman, I think that we don't receive that in a lot of areas of medicine. It just made me very emotional for all parties involved, because so I'm a therapist, and in a part of my work, I've worked with families. I'm a marriage and family therapist. Now I focus more on body image and eating and, things like that. However, I see how, but a lot of people don't realize that there is trauma in the birthing process. I've done trainings with Dr. Peter Levine, and I remember specifically a case where this very small infant, maybe toddler, like he was just so afraid of everyone in the world, and he would not stop crying. He would barely let his mother touch him. And Dr. Peter Levine, he does a lot of work on the body and like somatic work, went through this whole process of kind of healing that birth trauma with the baby. But since then, I've not heard of anything else. So, but let's talk about how we got here, how you got here, because your work is very, very personal to you. I had mentioned that you had gone through your own trauma, and it really, it almost took your life. So how has can you share a little bit about your story, and then how that shaped who you are today and the education and support you provide people around the world?
Yeah, absolutely. So my birth was supposed to be at home. And so when you talk to birth trauma survivors, you often kind of hear about how different what they initially hoped and dreamt of, what that ended up resulting in, which is trauma. And so I wanted to share just a little bit about that hope and dream that I had before everything else ensued. And so it was supposed to be a water birth at home. And my very first baby. And it was during COVID. So I also want to state that right out of the gates too. And so it was a very unique pregnancy in general, because, there were moments where my partner wasn't even allowed in the ultrasound with me. But when you fast forward to the birth, is that I had a midwife team at home in the water. And without going into too many details as to what transpired at home, even though it's actually really, really critical to the work that I do now, is that there was a series of midwifery events that took place that were violent. And so one of the aspects that comes up quite often in birth trauma is provider mistreatment. And in fact, actually, the research demonstrates that 66% of birth trauma survivors state that at the root of their birth trauma was how they were treated by a provider. So it's quite profound, actually. And so there were a series of things that took place in my home, anywhere from unconsented cervical checks to things like injecting me with things that I didn't even know what they were injecting me with, without that consent, not letting me go to the hospital when I asked and said that, I think I'm running a fever, I don't feel well, something isn't right. And so this went on for hours and hours, actually, at my home. It literally felt, this is truly the best way to describe it, like a horror movie. Like it
sounds like you were like kidnapped.
That's like, it felt like I was confined in my own home. That's the way it felt. And I had, my husband was there and my doula, but what happened to them is a really common trauma response that happens to most people, which is that they went into the freeze trauma response. And so they really shut down. And I went through like a mix of like fighting at the beginning and kind of advocating myself to just like giving up and going into that fawning trauma response, which is what I've done my research on. I'm not sure if we're going to touch on that today. But so, and the freeze trauma response. And so essentially after hours of dealing with this in my own home, I finally made it to the hospital. And when I did, thank goodness. So at like 9 centimeters dilated, my husband was driving me. So they didn't even offer to drive us to the hospital. Yeah. So literally the baby could have come on our drive, and the drive is half an hour. And so I think about that every time I go to present to that particular hospital. I think about how very little time we really did have, and could have been in a situation where I was giving birth on the side of the road. And so essentially we got to the hospital, and I still to this day don't know how it all transpired, but the hospital intervened. So initially when we got there, the midwives were still a part of my care. And then all of a sudden there was a doctor and a team of people that walked into my room, and the doctor said, I'm really concerned about you, because my water had broke. And so for those who have given birth, they'll know that there's like critical timing there that takes place, because after your water breaks, their infection can ensue. And so if that baby's not getting out within 24 hours, like there's serious risks there that are involved. And so doctor intervened and said, we're concerned. We think you're running a fever. So sure enough, that fever that I thought was transpiring, which the midwives were ignoring, was in fact there. And they said, we're not too worried about baby right now, but we're actually worried about you. And so he said, you know what, I'm going to give you 3 pushes. Okay, so he offered me an episiotomy and forceps. I didn't even know what that was. So this happens to a lot of survivors, is that you're not educated in the way that you need to be. And you end up in these situations where you didn't see them coming and didn't know what any of these things meant. And then you're just there making these decisions. And so he said either forceps and an episiotomy, or we're moving to an emergency cesarean. And I'm like, okay, I know what that is. So let me try and push her out. And so I got her out on that second push, but then what happened was that I suffered an excessive postpartum hemorrhage, which means that there was a great deal of blood that was lost. And so for me, it was near 3 liters, which is not good. And then I ended up needing blood transfusions, and I very much credit that doctor to saving my life. But then 6 weeks later, I would hemorrhage again due to a retained placenta. And so a lot of people actually don't know that you can hemorrhage up to 12 weeks after giving birth. I had no clue.
Wow.
So 6 weeks later, I didn't realize, why am I still feeling so sick? Is it because I spent a week in the hospital, because I almost died? No, it was also because I had retained product. And so, and then the story just continues and goes on and on. And the reason why I say it like that is because so many people just look at birth trauma as like one day that transpires and then it's done. And it couldn't be further than the truth, because it's always a cascade of things that takes place. It's like a domino effect for the individual who experienced it, but then also often their baby and their partner, and sometimes even family and friends. So that in a very short nutshell, small nutshell, is a bit about my story.
Yeah, I'm so sad that you went through that. And when you were talking, I just think of that concept of learned helplessness in that moment when you didn't feel like there was a way out of your own home for your own body and your own birth. And for the audience listening, there are so many things, like you said, that the nervous system really shuts down in a way to protect you, And we'll talk about fawning. But for the audience, I mean, that is a very real trauma. And I think as a society, we look at women and struggles in birth and we just are like, oh yeah, that's a part of the process. We very much minimized it. We invalidate, even without what you went through, the fact that birth is a trauma on the body. It is a full experience that requires way more recovery mentally, emotionally, and physically. So I'm going to say this a lot. I'm just so excited that you're here to share this. Talk to me about when you decided, you know what, I'm gonna share this.
Yeah,
I think it's important for me to start that Instagram page and talk about my story.
Yeah, definitely. So for me, I laugh about this sometimes because I had no idea when I started my Instagram what was going to happen with it. Truly. Like, so what happened was that at 12 weeks postpartum, I'll never forget this moment, actually. I was sitting in my recliner, and my friend, who's also a therapist, had said, I think I'm going to start an Instagram account and like talk about like parenting stuff and those pieces. And so I was chatting with her about it, and I said, well, what's out there for birth trauma? So I started to look, and I had already over the week since that happened been trying to find resources for myself, and I was coming up with nothing. And it was really discouraging because I felt so alone in the process. I felt really isolated. And I thought to myself, but this can't be correct, because at the time I was doing my doctorate when this happened as well. And I was looking at the research. I started to look at the research, and I noticed that it was like every stat I saw was 1 in 3 and up to 45%. And I said, well, where is everybody? Like, because where's the, hello, where are you guys? Because I feel really alone in this. And
it's a big amount of people too. You would think it would be
it's
readily
tremendous.
available.
And then it really brought me back to, my best friend at the time. Like, it was like 10 years prior to all of this happening, and her sharing with me about her birth trauma. And at the time, she didn't quite name it like that. But then as I'm reading all this research and looking into things, I'm really noticing the symptoms that she told me at that time were showing up in the research as well. And so I hear this from my friend, I'm going to start this Instagram. And I thought, well, what if I started an Instagram about birth trauma? Is anyone even going to pay attention to this? And honestly, I didn't care. Like, that wasn't the point of the Instagram. A lot of people go out there and they're seeking fame, or they're seeking, again, to influence people. That's not what I was doing. I wanted connection, and I wanted an opportunity to just even talk about my own story. So for me, it was almost like the lens of like a blog, if that makes sense, where it's like, okay, I'm going to use this Instagram, but more so these posts are going to be for myself. They're almost going to be like diary entries. And so I use the name The T on birth trauma because my name's Teela, but people don't call me that. People call me T. And so when I get called Teela, I actually think I'm in trouble. What did I do? Yeah. And so my family and my friends have always called me that. And I really like RuPaul's Drag Race, actually, and like how they talk about spilling the tea. And so it was a play off of my own name and, paying homage to one of my favorite TV shows that actually got me through my pregnancy, honestly.
I love it.
And so I combined it. And so I named my own Instagram, and I literally came up with it in 5 minutes. I was like, The Tea on birth trauma. And I just threw it out there, and it was neat because within a few weeks, this community had started to form. It was like word spread fast. And then I realized that there was, a handful of other birth trauma accounts at the time. And I felt really connected to those women and so grateful because they all offered like kind of a different lens on it, like depending on the area of specialty. Like say it was on like preeclampsia, which is something that, survivors encounter, or, one of a large account is the birth trauma mama, and she looks at amniotic fluid embolism. And so there were a few of us to start, and it's so neat now a few years later to see it has blown up. There are so many accounts on this, and I'm just really proud of the community. It's come a long way.
Yeah, that's amazing. Well, there was an obvious need, just understanding the statistics that you had shared. There was an obvious need, and I think you should feel, I'm sure you do, just so proud of yourself for taking that risk and knowing that it was just more to share your story, but realizing that our stories can impact so many people. And now you were kind of a trailblazer in creating now this community and this place for women to get this information. And I think, I believe wholeheartedly, even though you shouldn't have gone through what you went through, to me, there's always that other side of it, is like, what can I do with this that can provide good for the world? And you are that. So I just think that's wonderful. For those listening who may not understand or realize what birth trauma is, how would you define it? I know it sounds like there's these other areas, and specialties or focuses, but if we were to give it more of a general definition, or maybe if you can go through some signs of or symptoms of it.
Yeah, absolutely. So we like to say in the birth trauma community that birth trauma is subjective. And what that means is that it's in the eye of the beholder. And what that means is that it's not a choice that the person is making. So they don't just sit there and say, okay, like I'm traumatized by this experience, but instead it's a choice that the nervous system made in that moment, right? To try to support the person in just surviving. But the subjectivity piece speaks to like how vast it is, and that what may be traumatic to you may not be to me. And so we see this often when people look at my whole story in its entirety. Today, I breezed through it. Certain parts will really stand out to them, especially the hemorrhage, especially almost dying. And that's not what was most traumatic to me at all. Like at all, wildly enough. Like when I sit there and think about how close I came, yes, that feels really scary to me. But it was other aspects of it that maybe people would have missed even if they were watching it as an outsider looking in. And so first of all, and that you get to decide what that means. And so like I don't call your experience traumatic. You essentially get to define it yourself. And sometimes that feels trickier. We get into that comparison game of like, well, I didn't almost die. Do I have birth trauma then? And then you unpack that person's story and you're like, wow, you can really hear the trauma responses kicking up in moments and them, again, just trying to survive childbirth.
Yeah, no, it's so true. And a part of my work is as a trauma specialist. I worked with children and young adults mainly. However, it's that same idea. It's not what happened to me. I'm going to use the word perception of myself in that situation. And oftentimes that perception is actually, as you had mentioned, that nervous system response of saying, this is not safe. I'm either going to fight to get myself out of here, run out of here, but in a lot of cases, I cannot leave. And that's where that freeze comes in. Yeah. And I think that's so important for you to provide that information in regards to this, because a lot of women will, like you say, compare themselves. Like, well, wasn't that bad for me? But that doesn't mean that your brain and your body didn't have an experience that I'm going to say was similar in certain aspects of it. And that similarity is more of that, we're not safe. This is not safe. I'm not okay. I need to get out, or something needs to change here. And that can be so many things if you think about it.
Yeah. And so the symptoms that people will see, sometimes they aren't noticeable right away, because one of the parts of birth trauma that I think is quite dangerous is that we're in the thick of postpartum. And so a lot of things get ignored by ourselves, but also by everybody else around us. It gets dismissed and chalked up as like, you're just a new mom. And this is kind of what new moms or parents go through. And so I one of the areas that I also work in when I'm not with clients and running my center is that I'm a trauma-informed care consultant. And so I'm often working in the hospitals teaching doctors and nurses about trauma and birth trauma in particular. And what I'm often explaining to people is that how important it becomes around assessment. And so, for yourself, if you're thinking that this is something that you're encountering, you're looking for kind of those classic PTSD symptoms in terms of nightmares, in terms of flashbacks, in terms of intrusive thoughts. They say the research, again, so I'm such a nerd, hey, so I'm always going to go back to the research. And plus,
we love research around here.
Yes, evidence is everything to me. So the research explains that 70 to 100% of moms, 70 to 100%, I'm going to say that again, will experience intrusive thoughts. And an intrusive thought essentially is an unwanted thought, right? Like it doesn't sit well. And so that becomes the difference between like OCD, like behaviors or trauma, and, psychosis, right? In psychosis, the person isn't even aware that this is intrusive or disturbing or distressing. But an intrusive thought in its classic form is this idea of like, I don't want this thought. This is really distressing to me. And so moms going through postpartum with birth trauma will encounter those, like a consistent fear of thinking that their baby's going to die. If I close my eyes at night, I might die. So it's those intrusive thoughts. You're going to see anxiety and depression-like symptoms. But what gets tricky with the depression piece is that the research also demonstrates that too often birth trauma is misdiagnosed at first as PPD, as postpartum depression, because they look really similar. But one of the biggest things that I would ask providers in particular to do is like, instead of just asking like, how's your sleep? And then chalking it up to like, oh, well, that's just normal. Nobody sleeps during postpartum, is why aren't you sleeping? Okay, so don't just go as a provider with the assumption that it's just normal. Instead, if you say, why aren't you sleeping, or what's taking place when you try to fall asleep, you're going to get a really different answer from a birth trauma survivor. You're going to get, well, the second I go to close my eyes, I'm scared the baby's going to die. If I try and close my eyes, this flash from my birth, comes across my mind. And so we need to get a little bit more curious about how women typically present after, and being really careful not to dismiss those things as just normal postpartum pieces. And then you'll see a lot of guilt and shame. So if every time you're thinking about that birth experience, you start to encounter guilt or shame connected to it, those are often symptoms that show up for people. And then you see things like physical stuff connected to it, or sex and intimacy issues, or not really feeling like you're bonding with the baby. Like, all of those symptoms are worth getting curious about rather than judging yourself for.
Absolutely. We have a motto around here: when you get critical, get curious. So thank you for just reinforcing that. As your number one, I'm blown away by these statistics. I can also see how so many women are not properly diagnosed because we just chalk it up to, you're a new mom. You're a new mom. That's normal. New parents don't sleep. New parents, because you're not sleeping, then you might feel anxious, right? We just chalk it up to that. And I think it's so important for you to say that the level of assessment needs to be, we need to raise the bar. And honestly, how do I want to say this? It should have been there anyway, I mean, again, I just feel like the postpartum process, I have a client who's postpartum who lost a lot of blood in pregnancy, received some lab work, and has no idea what it said. And wonders why she's tired every day. Her iron was gone in her body. And I am no specialist in regards to labs. That's not my practice. But even just being able to look at that, I said, well, did anyone talk to you about your iron levels after pregnant? No, nothing. From your experience, do you feel like, I'm going to ask this a different way, do you feel that someone has to be obviously struggling to receive the support and the level of support they need? Or do you feel like with people like yourself that more providers are more aware of asking those questions, even if the client is, or the patient is presenting as okay?
No.
Okay.
I'm just going to be blunt about it because, and again,
that's what we do.
I do that trauma-informed care consulting is because we are so out to lunch on a lot of different areas. And going back to what we were just saying, it's too normalized in terms of just that, those first few months being a struggle for people. And so not only are we not asking the right questions, we're not even assessing. And so that's one of the things I'm constantly pushing for is that here, because where are you again? You're
Phoenix,
in
Arizona.
States. Yes. Okay. So, and it probably doesn't exist in the States either. And I'm connected to the States a lot, and I'm not aware of this, but in Canada, we have something called the Healthy Beginnings nurses. Okay. So these nurses, what happens is that if the file gets flagged in the hospital, okay, as maybe possible birth trauma or just something stood out to the doctors about it, then a Healthy Beginnings nurse is sent to that home within the first week. Okay. Now, they're not assessing. So they're not assessing for birth trauma, and they're barely touching on potential postpartum depression, especially because it's the first week. So sometimes those symptoms, you're not seeing them for a few weeks when it comes to the depression aspect. And so what I'm trying to get them to do is right out of the gate start to assess for this so that we can get ahead of things and people can stop falling in the cracks. because there's one opportunity for assessment. But then you fast forward to the 6-week checkup, which is a joke to me. It really is. It's often, here's birth control if you want it, see you later. And that's usually honestly the extent of the conversation. But there goes another missed opportunity to have that conversation around, like, you know what, I have this birth trauma scale. Can we take a few minutes to go over this and talk about what your birth experience was like? Even just asking that question, what was your birth like?
Right. Even just having it in your forms for that visit. I mean, it's really not that difficult.
No,
you know,
most doctors are not even looking at the file from the hospital. So for example, is that again, like I hemorrhaged 6 weeks later. So I missed that 6 weeks checkup appointment, but I got in a few weeks earlier than that because I had reached out to my GP and I said, like, I went through birth trauma and those pieces, like, can you please schedule me into her office? And you could tell she hadn't even read the note because when she got there, it was like, oh, how are you? How are baby? And then I see her pulling up neck care, which is what it's called here. And her face literally went white. And she said, what happened? And then we started to get into the conversation. But like, there's just a lot of gaps within services. And you see it a lot, especially in the States. Like, I'm well aware of what you guys go through out there. And there's just a lot of opportunities that aren't being taken.
Good news is we have women in the medical field who listen to this podcast, to women who are specialists in their own rights in, like I said, pelvic floor and pregnancy, postpartum, all of that. So y'all listening, take notes. There is an opportunity here to make a big difference.
Yes.
And I'm not surprised in that. Again, I think just women, like the way that we care for women in general is we're very strong. Obviously, we go through this period every single month, and we have cramps, we have pregnancy, we have perimenopause, and it's just like, well, that's just being a woman, and we're never assessing for things further. I am curious. I really want to get into the research you've done on the fawn trauma response, but actually, let's go into that first, because I think my next this question here will come up in that. So we've kind of brought it up, right, and explained your experience with it. But how does it show up in the labor process and the delivery process? What does that look like? And maybe even if you want to go there, like, feel like in your experience.
Yeah, I'll give a direct example of how I fawned and also how my partner fawned in a particular moment too. Because we don't talk enough about partners' experiences, and what's really wild about their perspective is that they are literally seeing everything. They are a witness to all of these pieces. For example, with the hemorrhage piece, like, I didn't know I was bleeding out. My partner did. Right? So again, like, he saw that and knew what was happening well before I did. And so I just want to highlight that. And maybe we can return to it later, but it's just something for your listeners to think about, is, again, like, how profound the impact is on partners as well. But with the fawn trauma response is that essentially the reason why I ended up doing my research on that was because there was a moment in my own therapy around my birth trauma that really stood out to me. And I didn't realize how much guilt and shame I was carrying around it until I started to do some EMDR about the birth trauma. And there was this moment when I was revisiting certain aspects of the midwifery violence and telling my story like I always do, almost like it's a grocery list, like it wasn't really impacting me because I had learned early on to detach from it because it was going through the reporting process. I reported those midwives, and that actually went on for 3 years. And they were found guilty and they admitted to everything that they did, but nothing happened to them. And that's another podcast. I know. Okay, so
my anger is coming. It's just rising.
Yeah, I fueling it with it, right? Like, I keep using that passion and that anger with me as a catalyst within the work that I do to be like, okay, things can be so much different, better. But yeah, okay, so getting back to this moment is that after hours of abuse from her, okay, so like the things that she would say to me, for example, would be like, Teela, So I'd be in like deep pain. I'd be like really concerned about, again, like the fever piece. I'd pushed for almost 5 hours to try and get this baby out. And she would say things like, you know what, Teela, nobody said that giving birth was going to be easy. And then she'd go and perform an unconsented cervical check. I would be begging her not to. There would be no reason either for her to be checking the baby. And she was literally holding me down in moments to perform it. Anywhere else where we would explain something like that, that's rape, right? That's sexual assault. And so that is absolutely how I view that part of my story, and how a lot of survivors who go through repeated unconsented cervical checks, whether they've said no or not, describe that experience. And so, like I said, there were so many different aspects of the midwifery violence. And after hours of enduring this, when we finally got to the hospital, I remember looking over at her and I said, "You must be so tired." And I was really compassionate in that moment. And she said, "Yeah, I am." And I said, do you want to go rest? Like that inner therapist in me, right? Like that compassionate person was just like, "Do you need to go rest?" And she's like, "Yeah, you know what? I've been at this for way too long. This is taking forever." This is how she was speaking to me throughout it. And, you know, I just came from another birth, and like, is this going to end? Like that kind of energy. And so she decided to go to the car and sleep for a couple hours while I was in the hospital. And I remember telling this part of the story during EMDR, and I broke down, sobbing, couldn't catch my breath. And I was like, what the hell? Why this part of the story? Like, why is this bothering me so much? And I realized that it was the fawn trauma response kicking in that moment with her. And I carried a lot of embarrassment about that in my time of need, so this is the fawning in a nutshell, in my time of need, I started to take care of her. And it was a way that my nervous system was strategizing how to get away from her. Okay, how to lessen the impact of the abuse, how to ensure that there wasn't going to be a big conflict moment with her. So what happens with the fawn trauma response is that it's essentially that please and appease kind of behavior. And so what you're doing is you're befriending the person that's harming you as a way to survive the moment. And so to the outsider looking in, the fawner is the best person to deal with. Okay, so when I teach this at the hospitals, I say, listen, this is the good patient. This is the patient that you all love. This is the one who's agreeing to everything, who isn't asking questions, who is smiling and nodding, who is checking in on you, who's being really kind and warm in the moment. Inside, they are anything but. And so what I teach providers is that, and this is what my research found too, is that we have to be so careful, because sometimes consent is fawning. Okay, that consent is not actually taking place, but fawning is. And so the biggest thing that my research found was that people were agreeing to interventions when they did not want them. But they didn't want the argument. They didn't want the conflict. So they said, okay, smile and nod, and did it. And inside they're like, I don't want this, and I don't know how to say no. And so I'm teaching people how to identify that in their spaces and get curious and really properly do consent. And that requires us going really slow, and the power dynamic shifting within the relationship so that people feel safe enough to say no.
Absolutely. This is so brilliant. And, you know, I wrote down, there was this sense of like gaslighting you in the process and making it about you, like, what's wrong with you? You know, yes, sure, this is hard for you, but it's hard for everybody. Like, you're not special in this moment. You're not safe in this moment. Oh, look at how you've taken my time from it. It is exactly what you call it. It is abuse. And I'm so proud of you for, I've never heard of a story like this, Teela, in regards to the birthing process. And I'm just proud of you for even recognizing it. It's funny, you say please and appease. I always say it's fight. Hold on, let's try that again. Fight, flight, freeze, or please. That's the way I explain it instead of fawn, because it just rolls off the tongue for me.
Right.
And yeah. And I love that idea, or not idea, I'm sorry, that you're educating providers to say, hey, look, we need to be asking these questions. And I think about, I used to have a co-host on this show who had a very specific birth plan, and she did not want any sort of intervention like a epidural. And at a certain point, I don't know if it was her doula who asked her or if she just said, give me an epidural. And her partner actually looked at her and said, that's not what you want. Think about if you would be okay with this tomorrow, the next day. And they had to kind of have this, I'm paraphrasing, but they had to have this interaction between the two of them, because in that moment, she's like, give it to me, right? And that might not be exactly what we're talking about here, but even just having those people around you who also can be able to support you and advocate for you, but then also having the medical staff and what you're doing and them being the advocate for their patient and making sure that the patient is 100% okay with what they're doing. I think that's wonderful.
Absolutely.
Wow. The question I was going to ask next, and this may actually just be a little bit of a segue. We don't talk enough about postpartum OCD. Is there research that connect? Because in my head, that makes so much sense to me, where we have this postpartum OCD after a birth trauma. To me, those two things align, but I never realized the birth trauma piece of it. Do you have any feedback on that or insights to that?
It's one of the areas that I want to research in the future, because I'm seeing a huge link there, like in terms of the clients that I see in my space, but also, again, just my understanding of how, like, okay, so a lot of parents that I see are NICU parents. And so that was their form of birth trauma, is that something happened with kiddo and baby had to stay in the NICU for a period of time. Now, what we see so commonly with those parents once they get home is what's called health anxiety. And health anxiety is often tied to OCD-like behavior, right? Where it's just like constantly checking things, Googling things, getting into like a sense of pattern in order to kind of control and deal with the anxiety that's popping up. And so I do feel like there is a connection for some people around those OCD-like behaviors and birth trauma, absolutely, as a way to, because that loss of control that we experience during trauma. And so it's the perfect breeding ground for something like health anxiety and OCD to come up.
Yeah, that makes a lot of sense, because when I think about just, in general, when we're working with someone with anxiety, or I'm sorry, with OCD, it's that sense of, keeping themselves safe in some sort of way and protection. And I can see that, even what you had said earlier about closing your eyes or constantly thinking something's going to happen to the baby. So then trying to control that environment in this very extreme way in an effort to prevent that makes a lot of sense. Just from my small knowledge of OCD, I'm EMDR trained, so I love that you brought light to EMDR, which is wonderful. It is. I'm wondering too, this wouldn't actually make sense. What I was thinking about in my head is, we have these new types of therapies, but your postpartum, so I'm guessing ketamine is probably not something that we're doing.
Not that I'm aware of.
That makes sense.
Maybe later down the road, but no.
True.
Yeah, breastfeeding
later on.
like those yes.
Yeah, I love it. So, why do you think? I mean, we kind of already touched on this, but why is birth trauma? I mean, again, I am a therapist. I specialize in trauma, right? I've worked in child crimes with the police department here, so worked with a lot of crimes against children, things like that. So I'm kind of in this other area. Why are we not having these conversations?
Oh, it's such a layered question. It really is. I think that it's just, for so long, it just was expected of women to go through, and it wasn't questioned. And if we did, then it looked like you didn't love your baby. And I think that is one of the biggest fears that people have in coming forward and sharing their stories, is that if I say that this was hard and difficult for me, then that must mean I don't love my baby. That's what people are going to think about me. And so you see that fear come up often for survivors, where it's like, I'm not going to voice this. And if I even try and do a little bit, I'm met with toxic positivity. I'm met with that idea of, well, at least the baby's healthy. You're healthy now. You know, at least you didn't die. Oh, well, things could have been so much worse. Like there's this energy that really takes place around mothering and parenthood, of just like, of sacrificing and not getting to complain about that or be upset about it. And so I think for as long as we've all existed, birth trauma has existed. Like, I don't know if you know this fact. This is an actual fact, okay? Because it's wild. I'm just going to prepare you.
All right, I'm ready.
Are you ready?
Strapped in.
Okay.
I'm ready.
Not made up. Do you know that why chainsaws were invented?
No. Oh, God, no.
For childbirth.
What?
I'm not kidding. I'm not kidding. So that's not a clickbait thing. Go look at it. That is a legitimate thing. The chainsaw was first invented for childbirth. So we want to talk about birth trauma and how long it's been around. And like let's not forget that, like, back in the days, a lot of women were dying. And that was also the norm of, like, baby got here safely, but mom died during the process. That was a thing that you saw centuries ago. And so I think that birth trauma has always been around. It's not a fad. It's not what's in or like the newest thing to talk about in postpartum. I think that people just finally feel safe enough because of different platforms that exist. Like, it's amazing. My DMs get filled all the time. And that's why I think even when you reach, I'm like, Christina, we need to go onto email because I'm going to lose you. I'm going to lose.
So thankful that you did that.
But it's like one of the messages that like really gets me, and they come often, is from a woman who gave birth like 40, 50 years ago. Will reach out to me. And they'll say, they'll be so emotional. Sometimes it's voice memos I get, or you can just like hear the emotion in their message to me. And they'll say, like, this conversation never existed, and what I wouldn't have given to have a place to talk about what I went through. And, you know, I don't know, that's just so profound to me. And like, there was this one research article that really shook me during my doctorate, where it spoke about how they went to women over 20 years later after they gave birth. And what stood out to those women were the words, again, that providers said to them, that they never forgot it. And most of it was negative. And that haunted them for like decades to come. And so it's just like this has always been around. We're just I think like kind of fighting back a little bit in motherhood for some time now. And this is one of the areas where just like, enough is enough. This is hard, this is difficult, and we're allowed to say that it is without like consequence of like, oh, you must not love your baby, or you don't like being a mom and that's why you're upset about this.
Yeah. So many things there. Number one, I feel like there's also a fear of being diagnosed, even with postpartum depression. I feel that women think if that happens, that there's a chance that someone's going to take their child away from them.
Especially women of color. Yeah.
Exactly. That's exactly what I'm thinking of. And as you're talking, I'm getting a bit emotional. That client I was telling you about recently said she had, I'm not disclosing anything about her, so no one would know who she is, had to step away from our time together because she felt like she was having a mental breakdown. And now knowing this, I literally going to call her after this conversation and say, hey, why don't you follow her at least to get some, we'll talk about where we can send her, because she's the one who lost all of the blood. And I also know her. She's very pleasing. She's a people pleaser. Oh, now my heart is hurting because of that. Let me ask you, you talked about the percentage of women who did die in birth, and we know that percentage has come down, but complications in birth, obviously death, and the fact that a lot of birth trauma, I forgot, was it 45% is provider abuse?
So up to 45% experience birth trauma. So define their experience as traumatic. And then 66% of birth trauma survivors state that the root cause of their trauma was provider mistreatment. Yeah. So
I'm curious. Yeah.
That's a big amount.
Well, I'm wondering too, and this is just my brain doing its thing. We just assume women die in pregnancy, right? Like that happens, not as maybe not assume it's not like okay, but we don't look at maybe the providers as much and their interference.
There's amazing accounts out there that do. And so like one I would shout out right now is American, and it's for Kira, for moms. And it was a Black woman that died in the States during the birth of her second or third baby, second. And this dad is incredible to watch. And since I feel like him and I began our accounts around the same time. And I'm just so proud of him on so many levels, like the fight that he has fought and like continues to for her death. And he argues often that there was so much that could have been done to prevent it. And again, like when we think about maternal mortality rates are 4 times higher for women of color, for Black women in particular. And so like, you got to get curious about that. And in my research, what came up around that was that women of color are often dismissed around pain management. And that goes way back. So again, if you look at times when slavery was taking place, a lot of Black women were slaves, but also like involved in science experiments when it came to birth. And were often, again, not given any form of pain management to see how that would ensue for them. And I think that sometimes those narratives still exist in the medical systems where it's just like, that's, that Black woman doesn't need medication. She's strong enough to deal with it, even though numerous times she's asked, or she's really struggling, or she doesn't feel like she can voice it because of that narrative. And so, yeah, like I think, and again, I'm not, and I feel the need to say this right now to providers who are listening, but like, I'm not anti-provider at all. I'm really not. I'm not anti-midwife even after everything that I went through. But what actually gets me excited and hopeful is that 66%, oddly enough, because I go to myself, well, that is preventable. That's 66% of birth trauma that we can actually do something about in our communities. And so like, and there are phenomenal providers out there doing really great work. And it's a systemic issue. It's so much bigger than them often too.
Right. Well, and I think I don't hear you being anti-provider. I hear you wanting providers to be the best providers they can be for their patients, by giving them this added education and support. If a provider is and I'll call them out. If you're hearing this and thinking, not me, I don't need to learn this, then that's a you problem. And that's a bad you problem to have. If anyone's offering to make you better from a patient experience, plus also a woman who has researched this, who is a doctor herself, who has the education, I mean, open your ears up, at least listen, because you're probably going to learn something you didn't know before and be a better provider for it. Anytime you listen to something and it kicks up something in you, like get curious. There it is. Coming back to it. I want to have this just real quick. I want to give an opportunity for you to explain about the partner aspect of the trauma. Because in my brain, what I wrote down here is there's this like level of layering trauma, because there is this experience that they're watching you go through, plus also the experience of themselves of not being able to help.
Yeah.
So I'm curious if we could just touch on that briefly.
Yeah, definitely. The analogy I like to use for people is that what they say about car accidents is that it's actually worse when you can see it coming. Okay. And we know this. So as trauma therapists, we're like, well, yeah, that totally makes sense. You tense, right? You tense, walk up, and then boom, the impact comes, and it does way more damage to the person who had no idea that it was coming. And so that is how I often explain what's taking place for partners, is that they see everything. They are literally in that moment, a bird's eye view of everything that's taking place. And they're like a provider in the room in that sense as well. And so I work a lot with vicarious trauma with providers. It's one of the aspects of the care that I do. And it's just like, but they're trained for that. Partners are not. So they're coming in there and knowing that they need to be a support to their partner during this. And then all these trauma responses are showing up for them. Again, most consistently, we're seeing freezing, we're seeing fawning, but then we see things like funny, right? So like cracking jokes, making light of situations because they're uncomfortable with the feelings. But one of the biggest trauma responses, and it's actually a bone I pick often, I need to pick it more actually on my own social media, but I talk about it in presentations, is that I struggle on social media seeing those reels and posts making fun of partners during childbirth. I know you've probably come across one, Christina, where it's just like, you know, where the husband falls asleep and it's like, who's this loser? Right? Oh, look at him, red flag, like all these pieces. There was a really interesting reel that Jen Hamilton is a very famous American. She is a nurse, an L&D nurse. She's hilarious. She runs this incredible account. And a couple months back, she posted this reel of this partner during childbirth who looked like he was going to pass out. And this is the flop trauma response, okay? And so you can see it, like he is going through it in this moment. And the nurse was so kind and warm. She sat him down, right? Gave him some water or juice or whatever it was and was like, hey, it's going to be okay. Like, take a moment. And she was really warm. And Jen was saying, what phenomenal care is this, right? And getting into it. And then the comments, people ripping him apart. And I took to it and I commented myself and it got thousands of likes, just my response saying we need to create more awareness around the flop trauma response, because what happens to partners is that the flop trauma response is like an even bigger version, in my opinion, of the freeze. And so your system is literally just shutting down on you. And what that often looks like is fainting. And it looks like someone who wants to lie down and go to sleep. Okay, their nervous system is like, I don't know what else to do here. I'm powerless. I'm helpless. And so you see this a lot. And so again, I want providers getting curious in that moment and being compassionate, like the one that you saw from Jen. But I just feel like that the narrative around partners also needs to change.
Absolutely.
Right? That like trauma impacts the entire family. And like imagine, like, and why not create a little bit more space to talk about the partner? This is the best friend that we chose to make a baby with. And so it's always interesting when people want to attack the partner online about that. And it's just like, imagine again, like how powerless they felt and how they're discouraged. Like the research around that is just that men are pushed to the corner of the room. They're literally not even spoken to in moments. So they will watch their wife almost die, their baby almost die, their baby and wife getting pushed down the hallway, rushed to go for an emergency cesarean, and no one even talks to him.
Wow.
Like, what are we doing, right? Like, if we're going to talk about this, it needs to be on like a bigger level.
Absolutely. Absolutely. I mean, that word that you use, powerless, whether it's a birth trauma or just experiencing the process of labor. I mean, they're just like, okay, you know, everyone just assumes they're the cheerleader, they're holding the knee, but that's their person. Like, that's the love of their life, their baby, you know. Yep. I'm sometimes the love of their life. I should say sometimes. That. Yeah, exactly. Not always.
I totally make space when I talk about partners on my page to give room to the survivors who are like, well, I had a shit partner. Okay, like, you know what? Yeah, shit partners exist. They absolutely do. I worked in domestic violence for a long time. I worked in sexual assault for a long time. I know this. And there are really phenomenal partners out there that are being traumatized as well. And so like, you know, we can care for those individuals too.
Yeah, as an MFT, I'm wondering too how that then manifests into their own like anxiety, depression, intrusive thoughts, and then how that affects the relationship.
Yeah. That's interesting.
Okay. Well, yes. Well, we have 3 now, or 2 or 3 that we're going to come back to. So just so that our listeners have something to walk away with, what are some practical things that mothers can do or expecting moms, you know, to prepare themselves to reduce the risk or at least be informed about what is, I'm going to use this word, okay, and what is not?
Okay. I struggle with this question, and I'm going to tell you why. Because as I just said, I worked in sexual assault for a really long time. So that's how I started my career. I've been a therapist now for over 20 years. And so when I started my career, it was in the hospitals, literally in the hospitals after someone had just been sexually assaulted. So I'd be there with them during their forensic exam, during their police statements. The state that I saw people in was incredible. You want to talk about vicarious trauma? After 5 years of doing that, it was really intense. And I struggle with this because it reminds me of what we would do to sexual assault survivors with the question of like, how can you avoid sexual assault? I view it
Agreed.
similarly. I do, where it's like, just, watch what you're wearing, carry pepper spray,
absolutely.
do this,
Not-
do that, carry keys in your hand. Like, it still has that energy. And so I really encourage people to think about this slightly differently, is that I actually think it's on us. I think it's on providers. So I think, and it's one of the areas that I work with, is that I'm working with doulas, I'm working with nurses on how to create a better prenatal program that tackles these things, that talks about birth trauma, because it is literally just touched on in prenatals. It's like 2 seconds because they're scared. They're worried they're going to scare people. And this idea of like, oh, if I talk about it, it will happen, or like I'm going to make, that parent really upset knowing this information. So we need to get better at normalizing this in the sense of like, this is just a conversation that needs to take place. If we know that the stats are 1 in 3 and up to 45%, you need to be including this in your prenatal course. So I think it starts there, that actually it needs to be in more books about postpartum, right? And pregnancy and all those pieces. Let's talk about it. What to expect when you're expecting. Let's also have some chapters on birth trauma, okay? So that people can start to understand, oh, this is a possibility that could happen. And like, what would this mean for me? And start to talk about it with your partner and like kind of create, for lack of a better word, like a plan around like, okay, if I have an emergency cesarean, I want you to go with baby right away. And I want to make sure that like baby's okay and like I'll be taken care of, or like, that energy. So I think it starts there. And then it also goes to, again, like, I think that it just needs to be the providers. Like, I think it needs to be the doctors and the nurses and the midwives and the doulas and the physiotherapists and the chiros and the lactation consultants. And it goes on and on, that if people are really informed around them, then they will also know how to handle the situation. And so first, let's normalize the conversation for people. And then the providers should know how to best care for somebody who comes in contact with it.
Yeah, I think that's a great example. We are obviously cut from the same cloth because the organization I worked in is called Child Help, and we had everything in one: forensic interview as well as exams, and then we provided the therapy for the children in that same situation.
Such a big difference, yeah, because then
it really does.
Traumatization, right? It's
Exactly.
like, let's get this all done at once and support this individual at once instead of like repeatedly like potentially harming them.
Yeah. Right. I love it. You're a gift to this world, my girl. I hope you know that. And this information is going to help so many men and women. And I think that's so important for those listening. Share this with your partners. I know off the bat, I have multiple clients who are currently expecting. One just had a baby 2 weeks ago, and so sharing this with your friends, getting it out to the masses is going to just help more. It's going to put, I'm going to use the word pressure on more providers to educate themselves. So speaking of that, if a provider is listening or anybody wants to find you, where can they find you?
Yes. Okay. So I'm in Alberta, Canada, but I actually see people across Canada with my designation, which is pretty great. You can find me. I'm the founder of the Reproductive and Perinatal Trauma Center here, which is like kind of a first of its kind. We support birth trauma, pregnancy loss, fertility struggles, as well as the reproductive end of things like endometriosis, PCOS. And as you've probably picked up on from me, we're also really proud that we support paternal mental health, so dad's mental health as well. And so you can find me at the Reproductive and Perinatal Trauma Center. So if you Googled that online, my website will come up and you can email me. You can find me at the T on birth trauma. So the tea that you drink, the T on birth trauma.
And we'll have that all of it linked below too, guys.
Thank you.
Yes.
And you can also find me at my center's Instagram, which is, I'm really proud of that. And I run that one as well, the Perinatal Trauma Practice. And so those are just a few of the places that you can find me. I'm really accessible. So whether it's like a DM, which you might get lost in, but don't worry, I'll find you, or just email me. I even have my cell phone number on my website for people to text or give me a phone call, because I want to be accessible to people. I want them to know that they can reach out with questions, whether they're a provider looking to get better within their practice and more trauma informed, or a survivor just looking for an ear, like just wanting to share. That happens to me often. So please know that you're not bugging me, you're not a burden, and that your story matters. I want to hear from you.
I love that. Thank you. Thank you for your time. Again, I'm so thankful for this moment. For those of you listening, again, like I had mentioned, please share this as you can. I think this is valuable information, and us as women specifically need to be able to get this type of message and education out to each other. It's the way we support each other. It's the way that we really make each other healthier and living, happier lives. So please share this if you haven't already, and you're watching our beautiful faces on YouTube. Hit that subscribe button. Plus, underneath on our channel page, you'll see the links to Dr. Teela. If you're listening to us in your ears, make sure you're following this podcast wherever you're listening to it. And we're going to leave you the same way I do every single week, reminding you that what you say in your mind, you see in the mirror. Bye-bye.